Good morning, Miss Patty. I have your discharge medication instructions for your levothyroxine. This is a medication that you've been on in the hospital, but you'll also be going home on this for your hypothyroidism. This is an oral tablet that you will take once daily in the morning. It is 25 micrograms, that's your dose. And you're going to take this on an empty stomach every morning about 30 to 60 minutes before you eat breakfast. And you will not take this with any other food or beverages, so just like a full glass of water. This will just help with the absorption of the medication. The tablet will come in a pill bottle. It's an oral tablet, and you will not crush it, chew it, or break it. It will just come as is, and you're just going to swallow the tablet whole. If you miss a dose, you will take the dose as soon as you remember it, as long as it's not too close to the next dose. So say you forget it in the morning and you don't remember till night, you'll just wait and you'll take it in the morning the next day. Some important things to remember is that you're going home on antacids and ferrous sulfate. This is your iron. And these two medications cannot be taken at the same time or within about 4 hours of your levothyroxine. So if you take your levothyroxine right before breakfast, you'll have to take your iron either like earlier or 4 hours later, like right before lunch.
Okay.
And then your antacids, these are kind of like an as-needed medication, so just if you need it, then you just adjust your, when you take this medication. You cannot take this medication with calcium supplements or other dairy-containing products because it will also affect the absorption of the medication. If you have any questions about what you need to avoid or anything, you can ask me, but when you go home, if you have any questions, you can also contact your provider. You will have some follow-up appointments just to go over some blood tests for your thyroid hormone, like your TSH and your T4. So they'll just get a good look at those labs just to make sure that we have you on the correct dose as well. Some side effects to watch for this medication is chest pain or heart palpitations, any unexplained weight loss, excessive sweating, or any intolerance to heat, and then tremors or muscle weakness. So if you're experiencing any of these, it's best to call your provider, and then they'll give you a better idea of if you need to come in or call 911. This medication just needs to be stored at room temperature and away from moisture and heat. So as long as you don't take super hot showers, it can stay in your bathroom. But if not, then it's probably best to like keep it out in your bedroom or in the kitchen or anything, and just away from children if you're worried about that. And then again, if you have any questions or concerns about your medication, you can always contact your healthcare provider. Okay, I know that was a lot of information thrown at you all at one time, so I'm just going to go through it with you one more time just to make sure that you understand it and know how to safely take this medication when you go home. Can you tell me what this medication is called?
Levothyroxine.
Perfect. And why you're taking this medication?
For my hyperthyroidism.
Hypothyroidism, correct. And then can you tell me when you're going to take this medication and how often?
One every morning and with a full glass of water on an empty stomach.
Perfect. And do you remember what I told you your dose was going to be?
25 micrograms.
Awesome. Okay, and then there are 2 medications that you're also going home on that will affect the absorption of this drug. Do you remember what those are?
Iron and my antacids.
Perfect. So just remember that you're either going to take those 2 either before you take the levothyroxine or at least 4 hours after you take it, also on an empty stomach. And then I told you about a food group that you need to avoid and a supplement if you're taking it. Do you remember what those are called?
No dairy or calcium.
Perfect. And we went over some serious side effects to watch out for. Do you remember what those are?
Chest pain, tremoroids, and my weakness.
Yeah, chest pain, tremors, and muscle weakness. You're correct. And then you're gonna store your levothyroxine at room temperature, so there's not really like don't put it in the refrigerator. Make sure it stays out of the heat. And then, like I said, yep, you're pretty good to go. You'll get it from your pharmacy. I'll send you home with this paper as well. It'll just kind of like answer any questions if you ever have them. And also your healthcare provider is also available for you if you ever have any questions as well. So it looks like you're good to go. You understand your medication. You know how to safely take it at home. But if you ever have any questions before you leave, you can always come and ask me.
Okay, thank you.
Perfect.